Before we commence this very exciting session, let me introduce you all to our esteemed panelists. हमारे साथ हैं Dr. Jugal Kishore, who is the Director Professor Head of Department of Community Medicine at Vardhaman Mahavir Medical College and Safdarjung Hospital. हमारे साथ जुड़ रहे हैं जीबी पंत हॉस्पिटल के डायरेक्टर प्रोफेसर एंड हेड ऑफ डिपार्टमेंट ऑफ साइकाइट्री डॉक्टर आरसी जिलोहा। कलिंगा इंस्टीट्यूट ऑफ इंडस्ट्रियल टेक्नोलॉजी भुवनेश्वर से हमारे साथ हैं असिस्टेंट प्रोफेसर डॉक्टर प्रताप कुमार जेना एंड फ्रॉम मौलाना आजाद इंस्टीट्यूट ऑफ डेंटल साइंसेज न्यू दिल्ली we have Dr. Shekhar Grover, who is a consultant for the National Health Mission. On behalf of KHUSHII NGO, I extend a hearty welcome to our panelists. I am Vrinda Saxena and I will be moderating the session for today. और सेशन शुरू करने से पहले मेरी फिर से एक रिक्वेस्ट है आप सबसे कि आप प्लीज सब अपने आप को थ्रू आउट द सेशन म्यूट पे रखिए, अपना वीडियो जितना हो सके ऑफ रखिए, एंड इफ देयर इज एनी क्वेश्चन, कोई कमेंट है, कोई सजेशन है, कोई क्वेरी है, तो प्लीज चैट बॉक्स का यूज कीजिए। वहाँ पे जो भी क्वेश्चंस एंड कमेंट्स आएंगे वो काफी प्रोफेशनल हो एंड वी विल टेक देम अप अकॉर्डिंगली। सो लेट अस स्टार्ट द सेशन फॉर टुडे। So Dr. Jugal, I would like to start the session for today by asking you to please elaborate on the relationship between tobacco use in adolescent and youth in COVID-19. Dr. Jugal, आप mute पे हैं. Can you please unmute yourself?
Yeah. Hello, everybody. Before answering this question, I just want to thank my panelists, particularly Dr. Jiloha. RC Jiloha is my mentor and my guru. From him only we have learned a little bit of tobacco cessation and tobacco control. We have worked with Dr. Pratap Jena, and a few research papers we have published. So we have a good relationship and understanding of tobacco in India. And Shekhar, who is working in dental college, he has worked in ICMR project on tobacco. So I feel that he can be a great help to all the participants. As far as the relationship of this tobacco and COVID is concerned, everybody knows that tobacco use, either in the form of smoke or chewing, both are dangerous to health. And if we talk only on the smoking part, then you all know that almost 7,000 chemicals are present in smoke, tobacco smoke, and more than 250 carcinogens and these compounds are there. So they directly affect the respiratory tract and the lung alveoli. So you can imagine that if a person is smoking tobacco, definitely he has more chances and more risk of developing the COVID, and the severity of COVID would be much higher. So there is direct relationship of tobacco smoking and occurrence of COVID in the population, particularly in young population, because otherwise their risk is quite low. But if they have added one more risk factor, that is smoking, definitely this younger population, particularly the adolescent and youth, may have more chance of developing infection, because their cells and their respiratory tract is already injured because of the tobacco. So the the virus can act on the cells much easy, because they are already injured cells and the immunity is also low. So therefore there is a direct relationship. Logically we can say we have the data on such kind of relationship as a causal association. Also we have many studies showing the relationship of the coronavirus, which were before as a SARS and the MERS virus, and then now the COVID. So the COVID is a new entrant, Not many studies are there, only just a few studies from the China indicating that yes, the smokers have more chances. Similarly, in Europe also we have got studies. So we can say the relationship of tobacco smoking and use of tobacco with COVID is quite high. So Brinda, that is my answer.
Moving on, हमारा जो दूसरा क्वेश्चन यहाँ पे आ रहा है वो मैं डॉक्टर जेना की तरफ डायरेक्ट करना चाहूंगी। डॉक्टर जेना, क्या आप प्लीज में बता सकते हैं कि क्या इफेक्टिव स्ट्रैटेजीज हो सकती हैं कि हम प्रोटेक्ट कर पाए जनता को इतने डिवास्टेटिंग हेल्थ कॉन्सिक्वेंसेस से जो कि टोबैको यूज से होते हैं। डॉक्टर जेना, कैन यू प्लीज अनम्यूट योरसेल्फ?
Yeah. So thank you, Ms. Brinda, for bringing out these important questions. At the outset, I would greet my panelists, Jugal sir, Jiloha sir, and Dr. Grover, and also greetings to all the participants. Now, actually, there are two broad strategies to protect public from devastating health consequences of this tobacco. First is first category of interventions is first category of interventions is health promotion. Now, this health promotion can be like we are promoting IEC, BCC, and doing media campaign. Also, it includes advice from the doctors also. Now, other health workers also. Now, this health promotion category of interventions one category, and second category is basically policy interventions. Now, in first category is the effect size. Effect size means if we do this IEC, BCC, effective media campaign, they can reduce tobacco burden in short term, that is up to by 5 years by 8%. And if we run it continuously for 40 years, its effect size can be 12%. That means 12% tobacco burden can be reduced. Now, but at the same time, other category within this health promotion, what I said, that is healthcare worker intervention, stand alone can reduce burden up to 4% in short term and up to 6% in a long term. Now, second category of strategies, we can say it is coercion or policy interventions. Here, what we do, we increase tax, we bring out comprehensive tobacco control laws into to be implemented to benefit the public. Now, some of the key strategies under this policy intervention implementation of comprehensive tobacco control laws like COTPA that helps in smoking ban, limiting access to tobacco, that is sale, buy or to minor, and also makes tobacco free school. Workplace also made tobacco free, and there is also possibility of display of prominent health warnings on tobacco products because of this law, and at place of sale. Also, there is prohibition on promotion, advertisement, sponsorship by tobacco industries. Now, all these interventions comes under our policy intervention or some kind of coercion we do. Now, in short term, these policy interventions can reduce tobacco burden in the range of 5 to 10%. And in long term, that is in 40 years, if we implement, it can reduce the tobacco burden by 10 to 18%. Among these policy interventions, alone rising tax 50% from the current level can reduce tobacco burden by 9% in short term and can go up to 18% in long term. But tobacco control strategy best works in comprehensive model. That means we have to implement all the possible interventions simultaneously. Standalone is not so effective. Interestingly, the policy making power rests with the government of India. Now, government is also promoting this, bringing COTPA law. At the same time, government has a stake in tobacco industry. Like that is happening news that government of India de-invested its share in Indian Tobacco Company. So you might have noticed in recent time that is a welcome move by the government. So government is the policymaker, and policy is more powerful than the IC, BCC, or even intervention by health worker. So government should be proactive and implement this policy interventions very well, so that this tobacco burden can be reduced. Over to Ms. Brinda.
Thank you so much. Thank you. So I would like to ask, there is this one question that has come up for Dr. Grover, and I would like to put that question before I take up more questions. So the theme for World No Tobacco Day 2020, Dr. Grover, is protecting youth from tobacco industry manipulation. So एक क्वेश्चन जो हमारे पास ऑडियंस से पहले आया था डॉक्टर ग्रोवर, जो हम आपसे पूछना चाहेंगे कि व्हाट आर द इम्पोर्टेंट स्टेप्स जिससे हम हमारे देश के युवाओं को प्रिवेंट कर सकते हैं टोबैको का यूज करने से. आप थोड़ा सा इसके बारे में एक्सप्लेन करेंगे हमें प्लीज.
Thank you, Vrinda, for this question. And I would rather thank the participant who has actually asked this question, and thank you to the rest of the panelists, respected Jugal Kishore sir, Jiloha sir, and Pratap sir. Well, to answer this question, I would rather first like to tell you the magnitude of the problem. So basically, the youth tobacco prevalence is at such a place in India that you can say that near about 14.6% of youth are actually addicted to tobacco. This comes to around every 2 out of 10 boys and every 1 in 10 girls actually use tobacco. So the number that comes in this question, the number that comes is like almost a total of 5,500 people, 5,500 youth get addicted to tobacco on a daily basis. So there's a large number of young people that are actually getting addicted to tobacco on a daily basis. The mean age of initiation in India has come out to be 18.7 years. And it has been proven by a lot of studies that earlier the age of initiation, the higher is the level of addiction in the later stages of life. So if a person takes up tobacco more likely like after 20 or 22 years of age, he is less likely to get addicted as compared to a person who is taking up tobacco early. Okay. Now, we were talking about the magnitude of and the level of addiction that the Indian youth is experiencing. Now, I'll tell you something about the factors that are actually influencing the tobacco uptake. The most common factors that are seen are actually the family members, if there are any existing family members which are smoking, any peer experimentation that goes on, it is mainly because of the friends or peers which are using tobacco, and then they are, experimenting with tobacco, and as well as the density of tobacco vendors and the density of advertisements in the nearby area. So all these are the factors that are the influencing factors upon youth. Question that you have asked me was that how is our tobacco industry manipulating the youth, which is the theme for the World No Tobacco Day this year. The theme is protecting youth from the industry manipulation and preventing them from tobacco use. So how does actually industry manipulates the youth? The tobacco industry acts by various factors. For example, they use attractive flavors that we come across many flavors in e-cigarettes or in cigarettes, basically menthol, cherry flavor, cotton candy, strawberry, all these type of flavors that are present. We have also heard about kesar ka dam. All these are attractive flavors that are incorporated into the tobacco products to make them attractive. They make sleek designs, and they make easy to carry products, especially the e-cigarettes. They make USB or pen drive shaped or a pen shaped e-cigarettes. These are the designs that actually attracts the youth. They also promote low nicotine or low tobacco cigarettes, which they promote them as low harm cigarettes. And we have also come across many events and sponsorship that are actually celebrity endorsed, but sponsored by the tobacco industries. So a celebrity coming up with some events that are actually promoted by a tobacco company are influenced by they somehow influence the youth. And various local factors are also there. there is a lot of marketing that is present in the TV, the films, or the media. Or we know about the web series that is coming on Netflix, Amazon Prime. All those web series are coming up. They have actually unregulated exposure of tobacco products on their films. And we also have like sale of loose cigarettes or small ready to use pack pouches that individual can take up as a whole. And basically they are making the tobacco as much affordable as they can make, so that the youth can actually take it up. So these are the basic factors which are responsible for youth uptaking tobacco, and these are manipulated by the tobacco industry. Now, how can we curb this? Basically the COTPA involves is a very comprehensive law, and correctly said by Dr. Pratap that it contains all the policy measures that are actually required to curb the youth uptake. But the basic point is that we need to have a very strong implementation. For example, we have smoke-free public places. So we have smoke-free shopping malls, markets, etc. But the implementation of these laws is very weak over there. So we need to strengthen up the implementation. There is an also a smoke-free educational or a tobacco-free education institution is actually the a very widely misused I would say law, that currently the law says that the tobacco products cannot be sold within 100 yards of schools or within 100 yards of any education institution. But over the period of time, and as evidence says, that not many institutions practice this.
लीजिए मैं हर पार्टिसिपेंट से रिक्वेस्ट करूंगी, आप प्लीज चेक कीजिए कि आप म्यूट पे हैं या नहीं. पार्टिसिपेंट 123 specifically directed at you.
Vrinda, if you're the host, you can actually mute him yourself.
Actually, that is the issue. We are trying from the host end. Akanksha is trying. We will just get to it. I'm really sorry. Okay, well, thank you so much, participants. आपने अपने आप को mute कर लिया है. So, Dr. Shekhar, would you like to go on?
Yeah. I was just saying that there are the methods that we need to have to curb the youth uptake are already available and mentioned specifically under the COTPA law. But the only key point that we need to do is the strong implementation. For example, I told you about the smoke-free public places, smoke-free shopping malls, and tobacco-free education institutions. But over the period of time, the evidence says that these laws are not being practiced thoroughly, and so therefore strong implementation is required, which is actually the part of the states. States have to implement this, and we need to make the youth understand that all these influencers like celebrity endorsed tobacco products and tobacco products, if used, they give us a macho image. All these should be removed. These influencers in our daily lifestyle should be removed. So these are the basic things. We need to regulate the exposures in the media. We need to regulate the exposure through social media as well. We need to regulate the exposure through advertisements that we see on a daily basis in the markets and nearby surrounding areas. As well as one more point I would like to emphasize is that we need to promote the cessation activities, because youth uptake we generally consider as not a very addictive stage of life, but yes, it can later on develop into a stronger state of addiction. So we need to promote the cessation activities right from the initiation age. So cessation activities can be promoted by apps, by cessation programs that medical colleges or dental colleges or other institutions can actually facilitate. So these are some of the points that we need to take through so that we can curb the youth uptake.
So much. Thank you so much, Dr. Shekhar. Again, I would request participants, please mute yourselves. Okay, one of the questions that has been coming to us, and Dr. Jena, I would like to direct this question towards you. So this question says that what are the strategies that can be taken by the Health and Family Welfare to implement the Cigarettes and Other Products Act at grassroots level, in especially during this time of the COVID? Dr. Jena, would you please take up this question?
Please repeat the question. Please repeat the question.
So one of the questions that has been coming to us is that what are the strategies that can be taken by the state health and family welfare ministries to implement the CODPA Act at the grassroots level, especially during COVID?
Yeah. Actually, the CODPA law is being prepared by the Ministry of Health, but implementation involves multiple stakeholders like police department, home department. So not only health department, other departments need to involved in implementing CODPA. Now, during this lockdown or COVID pandemic, the CODPA implementation is automated. Now people are not coming out, not smoking in public. So it is like, but there are some shops who are selling and people are using. But that is there. We cannot stop those things. But by default, this COVID-19 pandemic has is implementing CODPA law by itself. Now, what could be done? This is this other aspects of tobacco's control efforts need to be integrated in COVID-19 epidemic, like healthcare advising students, or during IC campaign of COVID-19, some of the TV channels are running do not smoke. That is an opportunity. Such kind of IC, BCC media campaign can be effective. But implementation of CODPA by default, because of this lockdown, is being implemented without intervention of government.
Thank you so much.
Brenda,
Yeah.
you had
Yes,
asked first question from the Dr. Jiloha. Can you repeat so I can answer the same question and then go ahead with
Sure.
my yeah. You have asked
Sure.
question. I will definitely try to answer what Dr. Jiloha has to answer.
Sure, sir, sure. So the question that was being directed towards Dr. Jiloha, I'll just repeat that. So do you think that the COVID-19 lockdown presents an opportunity for tobacco users to quit this habit?
Yeah, you rightly said that people think and thought, and even the many of the professionals and also expert thought that this is the good opportunity. It can be done. But I'll tell you first what is the problem with the tobacco use and smoking particularly, even tobacco use as a whole. There is a problem of addiction. The person who is starting this tobacco, it is not easy to quit.
Dr. Jugal Kishore.
Yes, sir. Please, sir. Up
Can I answer?
Yes,
Hello?
sir. Please, sir. Bataiye.
Oh, thank you for giving me an opportunity. I was waiting for a long time. And first of all, let me wish you all a very good afternoon. And it's a very pertinent topic of tobacco. Tobacco use is surely one of the strangest of human behaviors. How is it that nearly 1/3 of world's adult population performs this act, which is necessary neither for the maintenance of life nor for the satisfaction of social or cultural needs? Every year, more than 60,000 adolescents in our country take up to tobacco. And during this period of lockdown, during COVID-19, when majority of the children and adolescents are sitting at home doing nothing, they seek an answer to their idleness, sitting without doing anything, so they have to do something. And those who are already indulging in smoking behavior, there is an opportune time for them to go for it again, more and more. And there are many clues, like for example, a ashtray is lying in the house, cigarette packet is there, other member in the family is smoking, or even the smell of tobacco itself. These are all stimulating factors for him. So first of all these cues which stimulate a person to smoke should be removed during this period when the children or the adolescents are at home. Remove the ashtray. No other person in the house should smoke. Then if there is no smoking person, there will be no smell, there will be no stimulation. So the reasons were asked why it is difficult for the children to or the adolescent to stop smoking. One was taken up by Dr. Jugal Kishore himself, that addiction. Nicotine, which is there in tobacco, is highly addictive substance. Perhaps it's more addictive than the opiates or alcohol. And once a person becomes addicted to it, he cannot help to stop it. So de-addiction measures have to be taken for that purpose. That's one reason that they find it difficult to stop. Second is weight gain. That is a very important factor, particularly in the females, in girls and ladies who are dreaded of gaining weight, and they are smoking just to control their weight, because nicotine present in tobacco enhances our metabolism, and because of that there is no weight gain. But once a person stops it, metabolism slows down, person tends to gain more weight, and that is the reason that people continue to smoke. Third thing is depression. Those people who are in depression, they tend to smoke more. Smoking is prevalent more than 4 times in depressive patients as compared to general population. So if you treat depression, first of all, smoking itself will get automatically lower. What is stressors in life? This is a period of uncertainty, confusion, and a sense of urgency. And during this period, to combat their anxieties, people tend to smoke more. So these are the reasons, these are the difficulties which are the barriers which come up in stopping smoking. All these 4 factors have to be removed so that the person comes out of it and doesn't smoke. Friends, you know it that smoking is a gateway drug for other addictive drugs like opiates, alcohol. First person starts smoking and then goes for alcohol or something of that kind. So that way it is detrimental otherwise also, that if you smoke, you will be addicted to other substances as well. So to prevent those addictions, you have to stop smoking as well, first of all. So that's why it becomes more important that we stop it. Then how to go during this lockdown period or during the COVID period, how to go about stopping it? This is an opportune period. This is the time when people sit idle at home doing nothing. So first thing is that one has to determine that yes, I should not go for this habit. See, majority of the smokers leave smoking out of any therapeutic intervention. Only 8 to 9% people succeed with the treatment to be totally de-addicted. So first thing is, once you determine that yes, I will not go for it because of the harmful effects it gives, and moreover during this period of COVID-19, when our respiratory system is at risk all the times, and we are making it more vulnerable by smoking more and more. So first thing is that if you enhance your own motivation, that you will not go for it, you determine is the first thing. If you are motivated, only then you can leave it. So first of all, you have to enhance your motivation, and then of course you go for the therapeutic intervention. There are therapeutic interventions available. We have pharmacotherapy in the form of drugs. We have behavioral therapies, behavior interventions in the form of group therapy, and our other behavior modifications. Available treatment in the form of pharmacotherapy is nicotine replacement therapy, that is very effective. There are patches available which once you apply on your skin, that slowly releases nicotine and it replaces the nicotine which you get through the smoking. And that way you are spared of 7,000 chemicals which are there in tobacco smoke, and many of them are carcinogens. So that way the nicotine replacement therapy is there. We have varenicline, we have got amitriptyline, nortriptyline, we have got bupropion. So these are effective pharmacotherapeutic agents which are available, and they can help you in stopping smoking. But first of all, determination and your own motivation is most important. I hope this answers your question.
Yeah, very nicely given, sir.
Absolutely.
I could have not given such a beautiful answer. Yeah, Virinda.
Thank you so much. Thank you so much, Dr. Jiloha. The next question, Dr. Jugal, that has been asked in this regard is, what is the impact of using smokeless tobacco, and what is the associated risk of developing COVID-19?
Yeah, this question is also important. The smoking tobacco is having the higher risk because it has direct impact on the respiratory system. But the people think that the tobacco use, or say the chewing of tobacco, may not have that much risk. But in COVID, it is rather, I will say, have more risk than the smoking tobacco. The reason is that first of all, you are putting something in your mouth and you are chewing it, so your mouth become vulnerable to the injuries and infection. So the infection route is through your nose and mouth. Another one is that because you are spitting, if you are infected person, so you are spitting the tobacco again and again. So you are more dangerous to the society because you can spread. Suppose you have the minor symptoms, or maybe I think if you have asymptomatic case and you are chewing the tobacco, then you are spitting that to many places and you are spreading the virus. Therefore, either it is whether it is the tobacco smoking or tobacco use by chewing or by any other method, they have more risk of developing this disease and spreading the infection to others. So that is what to be understood by the population, that tobacco as such is not good in case of COVID disease prevention and control. Vrinda.
Thank you so much. Thank you so much, Dr. Jugal. Dr. Jena, there is one question that has been another thing that arises, जो हमने अभी तक discuss किया है, उसमें से एक question जो आ रहा है हमारी तरफ, that how can we build capacity for tobacco cessation during COVID pandemic? Dr. Jena?
Unmute karo.
Yes, unmuted. Yes, take some time. Yeah. Okay, so thank you, Brinda, again. And we can say this COVID-19 is a blessings in disguise. So there is certain opportunities because it has increased health consciousness. People are sitting watching TV most of the time, and I see being they're being bombarded with messages anti-tobacco, anti-COVID as a part of COVID movement. So that is actually people are health conscious. Now, this time, this tobacco cessation effort should be given more importance because people will have a more acceptability. Now, we have basically two basic ways to go ahead. First, I would say, see, we are motivated. We are all in virtual field. So, online training like this webinar is there. This should be made available not only healthcare workers but also interested people who want to counsel the tobacco users. Like massive online open courses can be made available, or webinar maybe specifically designed for healthcare workers and other counselor may be available for capacity building, and it is more useful. And the online this our virtual presence is going to be more meaningful in this time. And second, it can be, see, a lot of efforts is being given towards training of healthcare workers to how to treat, quarantine this COVID, suspected COVID as well as COVID patients. Now, this since this tobacco is a risk factor, now this training can be this tobacco cessation can be part of this training. Yes, it is a risk factor. Now, while delivering this COVID as well as training to the workers, so tobacco cessation can be integrated in so that it can easily reaches without additional resource to the healthcare people who can use it as a tool to educate and help offer help to the people for tobacco cessation.
Absolutely. Thank you so much, Dr. Jena. One of the questions that has come to us from the audience is for Dr. Grover. That Dr. Grover, what do you can you give your opinion about what do you think about how impactful are nicotine chewing gums used by youth these days? Dr. Grover?
Yes, thank you, Vrinda. Well, I have seen the question that I need to give an opinion about the nicotine chewing gums. The basic thing about nicotine chewing gum is that they are very effective, but one has to remember that they are a treatment modality. So it has to be taken up just like a pharmacological therapy and just not like a pop-in chewing gum. Okay. So it has to be taken only under the strict guidance of a behavioral therapist or a counselor or a tobacco cessation expert, but just not like since this nicotine replacement therapy has also been used by the tobacco industry as an adjuvant to expose more nicotine to our youth. So this can actually affect the user in a negative way. So, but if taken appropriately under strict guidance and under strict supervision of the cessator, this can be a very helpful source for quitting tobacco.
Correct.
Thank you.
Thank you so much, Dr. Grover. There is one more question that has come for you. That if we discuss the issue of spitting, I'd like to ask you to kindly elaborate on what does evidence say about restricting spitting, which is a vital step towards curbing tobacco use.
Yes, Dr. Jugal Kishore sir has mentioned about spitting in a very appropriate way. Spitting is, we all know, it is just a habitual offense that most of the people do, and it is more often conducted when a person chews tobacco, and it is more often conducted in a public place, obviously. And to tell you something about spitting, that spitting was actually recognized as a very indecent act in like more than 100 years ago in the Western countries. So that this act was rather initially when it was being conducted by people, it was rather acceptable in those times. But slowly the westernized countries, they recognize that this act is a very shameful and an indecent act, and they converted their countries into an unacceptable area of spitting. Now, evidence says, but I'll to tell you the truth that evidence is not very satisfying about spitting, but evidence does relate the public spitting with many communicable diseases, especially the tuberculosis, H1N1, swine flu, avian flu, pneumonia, and some communicable gastrointestinal diseases as well. So these are the evidence that, but I'm telling you beforehand that the evidence is not very satisfying, but they have been related to many communicable diseases. Now, regarding COVID, yes, a person who is infected or mildly infected or think may or may not be an asymptomatic carrier, yes, spitting does transmit COVID virus to the nearby surroundings, and it can stay viable in that spit for like up to 48 hours. Now, to curb this act, our our government of India has already enacted multiple municipal laws. This is not a new thing. That spitting is already banned, and we know that there are various sections under the spitting is charged and under the offender is charged. Basically, there are three sections under a spitter is charged: Section 268, Section 269, and Section 278. Section 268 is any act causing public nuisance. Section 269 is any negligent act that is likely to spread any disease. And Section 278 is any act that makes our atmosphere obnoxious to health. So these are the three sections, and we all know that there was a small fine that was imposed, but the implementation has been weak and it is practically negligible. Now, with this COVID times and recognition of the transmission impact of COVID by spitting, the government of India has actually recognized it and has actually imposed many laws, and it has called for a nationwide ban on spitting, as well as the use of smokeless tobacco, which causes the spitting. By lockdown 5, more than 28 states and union territories have actually accepted, and they have implemented a statewide ban on sale of smokeless tobacco as well as statewide ban on spitting. The act was already there, but it has been enhanced. The penalties have been increased to up to 2,000 rupees in some states, and may even call for an imprisonment of up to 15 days. So the penalties have been increased and stricter enforcements have been legislated. But from 1st June onwards, like this lockdown 5.0 that has come up, some states have actually relaxed the legislation back again, and they have started selling the smokeless tobacco back again. But the spitting legislation have been maintained as the same. So we hope that spitting may not be continued because of stricter regulations. But since tobacco is now available back in lockdown 5, it might affect a bit. Thank you.
Right. Thank you so much, Dr. Shekhar. Dr. Jugal, one of the things that we can focus our attention to now is that it is regarding e-cigarettes. So could you please explain to all of us some of the trends in e-cigarette use and the associated risk there of developing COVID-19? What do experts have to say?
Yeah, e-cigarette is supposed to be the alternative way of taking nicotine, and initially it was promoted as a safe way of safe way of smoking, because the majority of the problem is with the smoke, and e-cigarette appear to be that there is no smoke. So we are go away with the kind of, or say, 7,000 chemicals which are there, but it is found that actually aerosol created in the e-cigarette, it has a very high temperature, and the nicotine goes inside. So the chemicals may not be there, but the nicotine and the aerosol of a high degree temperature always go inside the respiratory tract. So it causes injury in the your respiratory tract very high. And nicotine has the all effect, which Dr. Jiloha has rightly pointed out, that what are the problem with the nicotine. And we are talking about that nicotine is addictive substance, and you keep doing it. So once you are addicted to, you are trying to take as much as to fulfill or to satisfy or to reach to your physiological need. So just replacing it is not going to solve the issue. In case of like Shekhar has also said that chewing gum is there. Actually, it is to replace the smoking. So you are aware that I am addicted to nicotine, and slowly I will quit the smoking, and then slowly the nicotine will also be I will leave the nicotine by slowly by decreasing the amount. But it never happened. That's a problem with the this e-cigarette. E-cigarette in younger population has emerged out to be one of the disaster, or say very high percentage of younger population and youth are using this vaping, or they are termed as a vaping, and it is available in various markets and promoted in different forms. And Dr. Shekhar has explained different types of smoking available with the color and taste and smell and all these things. So the e-cigarette is creating similar kind of risk as we have smoking and using tobacco, because you are injuring the respiratory system. Therefore, I feel that nicotine consumption is having the adverse impact on the health, and then allowing you, or say increasing the risk of having the COVID in you. Therefore, any kind of tobacco use is not good in COVID, and they should be cut down, or they should be deserted, or say we should try our best to control it, individually also and at the societal level. We were discussing about this cultural change as happened in Europe. So what is required is that we have forces which are creating a new kind of culture and new kind of demand in the population. So more and more people can take the cigarette, or say nicotine, so they continue to consume it because it has a market effect. But as we found that spitting or smoking is injurious and also dangerous and not a good habit, so we should create in our system that these kind of habits are not acceptable and they are not good. Unfortunately, in our rural areas, the hookah is accepted as social norm, and it is taken very high, and it has a relationship with our culture also. So if we can reverse it back, that even hookah is not a good one, but in urban population, also very elite societies, now hookah is coming back with more exposure to younger population. So I think more and more work is required, more stronger actions are required. Legislation is not enough, but I think mass movement is required to revert back such kind of development in the society.
Absolutely, sir. And there was a question by one of the participants that there has been a rumor that nicotine or smoking has a protective effect against COVID. I think that has been effectively covered by you. So, moving on to the next
Just want to
question.
say that yes, yeah,
Sure.
there was one article and it was showing some positive effect, but when it was further analyzed and found that, and a larger scale study was analyzed and found that no, this is not true. and we are coming up with many more studies that COVID does not have, beneficial effect. COVID patient does not have beneficial effect of, smoking. Rather, it is logical, it is scientific that person who is taking smoking have the effect on respiratory tract and also on the heart. All body functions are affected by the tobacco consumption or say nicotine. So you have more chances of developing the complications if you take the tobacco in COVID. So it is well established now. So people have this kind of rumors, which is totally baseless and it is not logical at all.
Right. Okay. Thank you so much, Dr. Jugal. Dr. Jiloha, carrying on this discussion forward, could you please elaborate on some of the health effects of second-hand smoking or passive smoking or e-cigarette aerosol? And what is the risk associated for developing COVID in this?
Hello. Hello. Ah,
Yes, sir.
Yes.
uh, as far as second-hand smoking is concerned, uh, people who are staying at home, particularly children, adolescents, and ladies who become the victims of second-hand smoking. Because if some adult smokes in the house and within the confines of the house, the smoke spreads all over. So it's equally detrimental to the people who are receiving this smoke as it is to the smoker. And the persons who are receiving this smoke, all these recipients are exposed to the risk of developing respiratory tract infections, emphysema, bronchitis, even heart problems, coronary artery disease, and other. Ultimately, if exposure is prolonged, there can be cancer as well. So, second-hand smoking is equally harmful to the people who are receiving it as well to the smoker himself. So that is very important that during this period when people are staying at home and in a limited space, and if someone smokes, he is not only harming himself, but he is harming other people who are around him. So one has to be careful and think twice before lighting a cigarette in the presence of children or other members of the family who are passive smokers. So that is one thing. Second thing is that about COVID-19, when people are staying at home and someone is smoking, that is not only harmful to the person himself, but it harms other people who are in the house, and that's why it needs to be stopped altogether.
Just
Right.
want to add here, sir. There are studies showing that the people who are taking second-hand smoke have more risk of developing the COVID, and the severity of infection is also quite high in case of the second-hand exposure
Yeah,
of the smoke.
yes, that is quite evident because
Yeah,
your respiratory system is already exposed to the risk.
true,
Because
sir.
in COVID also there is a first attack on the respiratory system, and once your respiratory system becomes vulnerable, it exposes the person to the risk of getting coronavirus infection. Otherwise,
True.
also second-hand smoking or the passive smoking exposes the person to the risk of all kind of complications. There's no organ or no system in the body which is not affected by second-hand smoking, whether it's a respiratory system, cardiovascular system, your reproductive system, even your skin. All the systems get affected with second-hand smoking. So one needs to be careful about it.
Yes. Thank you so much, Dr. Jiloha, and thank you so much, Dr. Jugal. Dr. Jena, one of the questions that we request you to take up is, can you enlighten us a little about the use of water pipe and that risk and associated risk of spreading COVID-19? Dr. Jena?
Yeah, yeah. So, am I audible?
Yes.
You are, yes.
Yes. So, basically, already Jugal sir has pointed out some forms of tobacco use are socially acceptable, socio-culturally acceptable, and water pipe use in northern India is a socio-culturally acceptable form of tobacco use. It is considered as a disrespect if you want to offer. So what happens when people use this water pipe? You don't you have to you cannot obey the social distancing. And second, instead of cough, you are people smoker are providing their saliva to it, so that it can transmit, and not only respiratory viruses like COVID, other viruses like hepatitis C, Epstein-Barr virus, herpes simplex virus, tuberculosis, pylori, aspergillus. A lot of things can be transmitted by sharing this water pipe. So first point is because of sharing, and which is considered a social respect or social norm, and it has socio-cultural value. So you cannot restrict it, and social distancing you cannot maintain. So through sharing, you can transmit other COVID virus as well as other virus. Now, second is, now this water pipe users, they are also smokers. Now it damages their lung. Now there is a lot of force involved while taking that form of tobacco. Like any other form of tobacco, it damages our lung. Now it increases like a important comorbidity. It increases risks when people are affected with COVID-19. It increases risk of mortality and serious illness. So these things to be remembered. First one is sharing is a not only COVID, it can transmit other forms of infections. And second is this compromised lung because of their smokers can increase the seriousness of illness as well as mortality of COVID-19 patients.
So thank you so
Yes,
much,
Ms.
Dr. Jena. So due to paucity of time, I mean, we have a lot of questions, but because the time is restricted, we can only take up one more question. So probably the last question is, I would like to address it to Dr. Shekhar. So Dr. Shekhar, one of the questions that is being asked is that although nicotine chews are known for their therapeutic benefits, but sometimes what happens is that school-going adolescents or teenagers start using it as a precursor to smoking rather than to use it for quitting smoking. So what do you have to say on that, Dr. Shekhar?
Well, thank you, Vrinda. I think this is in the continuation of the previous talk that I just gave, and I told about the nicotine replacement therapy, which should be actually taken only in strict supervision. But I have also mentioned that the tobacco industry has made the nicotine replacement therapy available over the counters. So it becomes actually a gateway wherein the students can actually take up the nicotine replacement therapy as a popping chewing gum, and then actually it can actually act as a gateway to smoking. The main point here is that we need to make sure that the adolescent should not be exposed to nicotine chewing gum unless they are actually proven to be addicted to smoking, and then they should be given up proper cessation guidance and subsequent nicotine replacement therapy should be started. Okay, so otherwise the level of addiction will rather increase in them.
Right. Okay. Thank you so much, Dr. Shekhar. I
Vrinda,
would like to. Yes, Dr.
Linda,
Jugal,
I
yes.
think Dr. Jiloha can answer that question. One has asked whether the electronically delivered nicotine and has the same impact or effect as we have the electronically delivering non-nicotine
No,
delivered. So I think that is a good question.
sure,
Dr.
sure.
Jiloha can answer that one. You can ask again.
Dr. Jiloha, there is one question we would like to address to you, sir. This has come from the audience. That is the electronic non-nicotine delivery same as that of electronic nicotine delivery system, and do they both have the same kind of ill impacts?
Hello. See, delivery of nicotine in any form, whether it's electronically delivered or it's through smoking or it is through chewing, it is equally harmful because when it reaches our neurons, after smoking, it reaches within 7 days to the neurons and it gets combined to the nicotine acetylcholine receptors, and from there there is a addiction which occurs. So any form of delivery of nicotine causes addiction, and addiction is harmful, that every one of us knows it. So whether it's delivered electronically, whether it is delivered through smoking or through chewing, it is equally harmful. The lesser harm is that because other smoking contents, which are 7,000, has been variously described by various speakers, those harmful effects are not there because uh, others like carbon monoxide is there in tobacco smoke, which combines with hemoglobin and forms methemoglobin and decreases the oxygen carrying capacity, and because of that smoking becomes a more risk factor for the COVID as compared to nicotine, which is delivered through electronic media. But it is otherwise harmful that it causes addiction. So it is just a question of few things which are here and there. It is harmful because it causes addiction, but it may not be having that much of risk as compared to smoking as far as COVID is concerned.
Right. Thank you so much, Dr. Jiloha.
Sir, I would
So,
like to add in here.
yes, please.
Hello, can you
Yeah,
can you
yeah.
hear me, everyone?
Yes.
Sir, I would like to add in here that there are two forms of e-cigarettes: electron nicotine delivery system and electronic non-nicotine delivery system. Actually, this is actually a misnomer which has been created by the tobacco industry. There have been multiple systematic reviews and meta-analysis which has actually proved that both of the products contain similar kinds of chemicals, and both of them contain nicotine as well, which is a highly addictive compound. Third thing, that this is a tobacco industry propaganda to make vaping, to make appear vaping safer. So and obviously all of these products are unregulated. So this is just a misnomer and a propaganda used by the tobacco industry. Actually, both of the kind of products are equally harmful.
Okay. Good.
Thank you so much. Thank you so much, Dr. Jiloha and Dr. Shekhar. Thank you so much. Dr. Jugal, I would like to kindly request you to please conclude the session for today.
Yeah, it's a wonderful session you have conducted, and all the speakers have answered the questions, and one or two questions we have taken from the audience also. And those who have attended, I think they have enlightened by the panelists. They were discussing about various risks of the tobacco in the form of smoking and chewing, and that is affecting our body. Dr. Jiloha has rightly said that all part of the body is affected by our smoking and tobacco and nicotine, and therefore, it should be quit. as fast as possible. Although it is an addiction and it may require some kind of help, but the self conviction is the most important component, or say the best to quit the nicotine dependency or say addiction. If one is not determined that I want to quit, nobody can help. But yes, all kinds of this kind of addiction make you more vulnerable to various kind of infection. And this COVID which is creating so much fear, and everybody is concerned about it. And if those people who are smokers and using tobacco, if they can understand and they are listening, then I think first things they should do it to quit it. They should leave it, this habit, so the risk will decrease. So if they want to make them safe from the COVID and coronavirus, best is to quit tobacco and smoking. Is much better. I think your 50% chance of becoming corona will decrease. So that is what I wanted to say. It's a wonderful session and a very aptly, design and very important for today's concern. Vrinda, thank you very much for moderating and conducting the session. And KHUSHII also, like KHUSHII NGO has organized this. Thank you for that.
Thank you so much, dear panelists. This has been a great session, as Dr. Jugal pointed out. So, and thank you, dear participants, for joining us. I'm sure and I really hope that this has been an enlightening experience for all of you. Thank you, KHUSHII NGO, for organizing this. And I hope that you are all, we stay at home and we stay safe. Thank you so much.
Okay, sir.